as every year we do at Vanguard, we sort of do a health update, and this will actually be a full presentation on our YouTube channel in the next 10 days, but just what we call our annual health update. Of course, it focuses on the African-American community, but it also just talks about what's going on in health in America. And we can't have a full 2023 health update without discussing COVID-19. And unfortunately, COVID-19 has shortened the lifespan of all Americans. It has dropped from 79 years in 2019 to 76 years in 2021, and the lowest that it's been since 1996. Native Americans saw the biggest decline in life expectancy with a shocking drop of almost 6 years in their life expectancy, despite efforts and compliance with getting vaccinated, but there was concerns that their community get vaccinated fast enough. African Americans, our life expectancy has dropped about 3 or 4 years as well. White Americans still have the longest life expectancy in America at 76 years. African Americans, that gap has expanded a little bit, particularly among African American men, but we're about 70 and a half years. Interesting, another thing that happened in the past couple of years, in addition to the COVID-19 vaccine deaths related to it coming up to number 3 in causes of death, drug overdose deaths jumped significantly, almost a 22% increase in 2021 alone. And this also is concerned because there's been a significant increase across all socioeconomic groups and an increase in alcohol use. So we might be surviving COVID-19, but there are definitely clear indicators that we're not coping well with it. And I say that to this group that the work and efforts of Lifeline still remain very important and very critical towards helping people feel safe and feel like they have a positive way forward in this new year. But despite everything that COVID-19 did, it didn't replace cardiovascular disease, which is heart attacks, strokes, and those type of things being the #1 cause of death in America. And it didn't replace cancer from being number 2, with particularly colorectal and prostate, pancreas probably being the highest of them. And the American Medical Association reported that African Americans still have almost a 24% higher mortality rate than whites, which is just not a great number. Some of you may have seen in the past week that CNN, American Cancer Society, has put out some great news in the sense that deaths from cancer has dropped 31% in the past 2 decades. But the sad news in that is that the disparities between African Americans and white Americans actually increased. It's up to now 12% that we're dying at a higher rate from cancer than white Americans. And one of the biggest causes of this is a significant spike in prostate cancer. So definitely this year, we want to be dialed in for men of all races and backgrounds being appropriately screened and appropriately treated in prostate cancer. In addition to these more popular, well-known causes of death, there's 2 other things I would like to put out there for our consideration. Prison incarceration and abortion, particularly as being leading causes of death in the African-American community. A study done in 2017 showed that for every year someone was in prison, their lifespan was shortened by 2 years, with suicide still being probably the #1 cause of death of incarcerated peoples, which is just not. Sorry. Can you still hear me?
Yes.
Yeah,
Okay,
you're going in and out, but this is some important information.
Yes.
Could you say that again about the incarcerated, because you was going in and out about that?
I'm sorry. That the death rates among incarcerated people for every 2 years of, for every year of incarceration can drop the life expectancy almost 2 years.
Wow.
And that suicide still remains the highest cause of death in the prison population. Just so that the stress and the imbalances that come with being someone who's incarcerated. You can hear me all better now. In our center, sometimes the signal is just horrible.
No,
sorry.
We understand.
So those are, I'm sorry.
Go ahead.
So, and another thing, that the 2020 Kaiser Family Foundation showed that African American women had the highest number of abortions at 130,000, followed second by white women at 108,000.
Uh-huh.
And there's data showing that how this relates to poverty and how this relates to education choices. So before I go on, I just want to recap what I've shared so far. Coming out of this COVID-19 pandemic, we still had some consequences. Our overall life expectancy has dropped by 3 years. We're seeing a significant increase in drug overdose and alcohol abuse. Heart attacks and strokes still remain the number one cause of death for all Americans, but cancer is still there as the number two. And that Native Americans and African Americans still have ridiculously higher mortality rates and shorter lifespans when they are compared to other racial groups in America. But I do think for our group and our community, there's some things that we can do to help improve our life, our health, and increase our lifespans. So I want to share this morning some tips on prevention and screening. And I'll start off with tips on prevention. And the first one at the top of the list for prevention is tobacco and tobacco-based products. While tobacco is still disproportionately marketed in certain communities, we still have to push ourselves to make better choices. Tobacco has a direct causal relationship in at least 5 types of human cancer. It plays a significant role in damaging our blood vessels, our teeth, our hair, and our extremities. The loss of life and environmental damage that tobacco has caused in communities of color and in communities all across the world and country is stagnating. And several of these tobacco companies have more money than the GDP of several countries, so we cannot underestimate that effect. That vaping is a tobacco product, that chew is still a tobacco product. It's not just cigarettes. We have to be very careful of the tobacco in our life and in our communities. The other important measure we want to address is our consumption of sugar. Most of us just think of sugar as candy, but sugar and snacks, but sugar is also hurting us in the form of hard liquors, cereals, breads, foods that have high fructose corn syrup and that we don't think about. And this sugar consumption that we don't pay attention to is causing an insane increase in diabetes in communities of color. The sugar intake relates to our obesity rates, our higher tooth decay rates, our pancreatic dysfunction, liver disease, and bad cholesterol. And something else we all want to bear in mind, that actually having excess sugar will weaken our immune system. It increases the amount of hormones in our body that dampens our immune system's ability to respond to infections. So what can we do to prevent diseases in our community and prolong our lifespan again? Besides tobacco and sugar, we also can talk more frankly about the use of condoms. No matter how safe we are, condoms are definitely a life-saving thing. Condoms help prevent the transmission of STDs, human papillomavirus, which has a high rate of cervical cancer and anal warts and anal cancer. The human immune deficiency virus, HIV, it is still increasing. And where is it increasing? In young Black males and senior citizens. Syphilis and gonorrhea is still running around. And all of these things are causing significant harms in communities of color. HIV is still killing people. It is still breaking down the body's immune system and allowing its sufferers to get unusual, life-threatening diseases. In addition, condoms will prevent unwanted pregnancies, which can then prevent the need for condoms. Another form of life-saving prevention that we can't overlook in our community are vaccines. Horrible life-threatening diseases such as polio, measles, mumps, hepatitis, all forms of it, and COVID-19, they have been either eradicated or neutralized by vaccines. However, in the past decade, we've seen a lot of resurgence and spikes in these diseases because of conspiracy theories based on a lot of pseudoscience, making us all have a higher disbelief in vaccines. But just make no mistake about it, vaccines work. Vaccines played a huge part in increasing the average American lifespan by 30 years since 1900. We cannot let ourselves get blown into this autism phase of all of a sudden something that has never been directly proven to be a cause or a link to make us do behaviors that will unleash several diseases that we know will hurt us individually and our communities. So once again, our overall life expectancy is decreased. Heart attacks, strokes, cancer, COVID-19 are among our top causes of death. African Americans and Native Americans are dying at higher rates, but we have some preventive measures. We got to avoid tobacco products. We got to avoid bad sugars. use condoms, get vaccinated. And then there's two other things I would like to get into before closing, is that I want us to think about legislatively, community activism wise, that health screening and importance of Medicaid and improving our health and longevity. When it comes to cancer, screening isn't a random exercise. Screening is the first line of cancer treatment. Proper cancer screening has been proven to save lives and decrease the need for aggressive forms of treatment. Unfortunately, many people of color do not get properly screened, even when our physicians recommend to do so. So I can't state it enough, my friends. Get your pap smear, get your colonoscopy, get your mammograms, get your PSA blood test, get your chest histories. These are simple things that could save your life. These are simple things that can decrease the cost of your treatment. These are simple things that can help you live not only longer, but healthier. Medicaid. Medicaid is actually the largest provider of health insurance for all children and adults in America. Now, specifically, what is Medicaid? It's a federal program that's administered by the individual states, but the funds come from both that state and the federal government. It's a social aid program that's designed to aid the poorest citizens in America. And I always pause about that because it's kind of astonishing to me. America, we're supposed to be the richest country in the world, at least our stock markets say so. But somehow our largest provider of health insurance is the one that covers poor people. That doesn't really compute to me. That if you want the biggest argument that income is not divided appropriately in America, just look at how our health insurance is broken down. That we have so many poor people in America that our health insurance for poor people is the largest provider of healthcare. So in addition to protecting Medicaid and protecting the Medicaid expansion that's in Obamacare, which has been proven to increase the lifespan for not only peoples of color, but for all citizens in the states that participate in it, we want to make sure, and if you want more information, we actually have a video on our YouTube channel about Obamacare and Medicaid. But we can't understate this fact that this program, does it work well? Absolutely not. But does it provide a needed gap in Americans' life and lifespans? Yes, it does. So I would say clearly, it's not about getting rid of Medicaid. It's about making Medicaid be better. Maybe Bernie Sanders isn't so crazy when he's saying take people off of Medicaid and put everyone on Medicare, which actually does an amazing job given the fact that it takes care of one of the sickest groups of our populations in America. So in summary, everyone, our overall life expectancy has decreased and we have to do some things to improve that. The number one causes of death remain heart attack, stroke, cancer, COVID-19, and drug overdose is coming up on the rise. Black and Native Americans are not doing well in terms of lifespan. So we as a people of color, we like to talk about the fact that Black don't crack, but we have to ask even harder question, well, how long does Black last? There are preventive measures we can take to prolong our lives: avoiding tobacco, avoiding bad sugars, using condoms, getting vaccinated, getting appropriately screened for cancers, blood pressure, and sugar, advocating for Medicaid and healthcare access programs, and understanding that these access programs, no matter how underperforming they may be in the opinion of others, they have still had positive impacts and increases access to healthcare and life expectancy for not only people of color, but for all communities that participate in them. That's it. I just want everyone to know at the Vanguard Health Equity Project, we really believe that God wants everyone to be healthy and that having health is freedom. Thank you all for your time. I hope what I said was helpful.
Oh my goodness. I am so blessed.